Good afternoon. This is Stephen C. Fales, MD, with my website talkfromdoc.com and Straight Talk from the Country Doc. I want to mention a few things about healthcare in general and the politics thereof and the economics thereof and the morality thereof. And I want to do it in the terms of the question, should healthcare be free? Or a related question, is healthcare a right or an entitlement or a personal responsibility that a person should pay for themselves? You know, if something is free, it's usually overutilized. That's one issue. And you can imagine if everyone had healthcare for free, that the system would be strangulated. But assuming people use common judgment, we still have a lot of issues if healthcare is going to be paid for by the government. The problem arises that when healthcare is a right and paid for by the government, in the past the budgeting process has been very painful. In fact, it's almost non-existent. In Medicare, as years have gone by, it seems that there's been no control on the costs, except for lowering the reimbursement to the hospitals and doctors and so on by mandate. And you know, there's no negotiation for doctors who take Medicare, and most of them do. You have to more or less just take whatever the rate is. Doctors unfortunately have demonstrated quite a bit of greed in that system, in that as their reimbursement has gone down in a rather vicious response, physicians have found ways to just get around that by ordering more and more tests, seeing people more often, rendering less service for the same amount. And this is just a natural consequence that will happen, does happen, as the government takes over healthcare. I have many things to say about this issue because I see it manifest in my practice, with my patients, with my various entities I've been in, the various models of providing care. And it may be difficult to hear, and it may be unpleasant for many people to hear, but if you're going to have government-run healthcare, you're going to have a disaster. If the physicians are going to be paid by the government, you're going to see the government's trying to pay them less and less and less and expect more and more and more. And many of them will jump ship unless they're forced to. Don't be surprised if the federal government and the state governments force physicians to see their patients if they have a license. You may think that's fine. They have a license, they should see everybody. But unfortunately, it will not work. Many physicians are considering bailing out already, and only perhaps doctors from other countries or who aren't successful will be there to take care of people. These are things that are very important to think about, and I discuss them more on my website and in my blogs, and in my essays, in my forthcoming book. Look forward to addressing these issues and exploring them with you. Thanks a lot.